Hello everyone, I'm Vivian Benjamin. I'm a registered nurse, registered nutritionist, and the founder of Nutrition Takes. Today, in Nutrition Takes video channel, I'm going to talk to you about bone health and how you can protect your body's architecture. Have you ever imagined how you would look like if you had no bones in your body? Well, we would possibly look shapelessly unable to hold anything. The bone inside your body gives you not only a framework, but also protection. However, many people are constantly getting bone diseases every year. The most common type of bone disease is osteoporosis, which leads to more than 8.9 million fractures annually worldwide. Poor nutrition, along with lifestyle factors, are the main causes of bone impairment, which can be modified. On the other hand, non-modifiable aspects are age, gender, and family history. Apart from that, inflammation and infection also damage your bone. I always say this to my patients or clients. Your body acts as a whole one unit. Therefore, damage in one part of your body, be it the organ or tissues, eventually leads to damage in other parts of your body. On the flip good side, if you nourish your body from the inside and outside with sufficient nutrition and a positive lifestyle, you can prevent diseases and even heal your body. Of course, I'm not telling you if you practice these good habits you will live longer and not die. Scientific advances are helping us live longer, though not forever. Age is something no one can defy. Nevertheless, you can help your journey in life to be less damageable as possible. Did you know poor bone health also affects children? Parents must be vigilant in caring for any trauma or accident affecting the child. Similarly, observe your child's growth on the outside for any abnormalities. If you notice anything that is not right, you can always talk to a healthcare professional. Children may also exhibit pathological fracture, which happens in abnormal bones during everyday activity. Likewise, it can also occur due to minor trauma. So, checking in with your children after minor trauma is essential. Children may also develop insufficient calcium and vitamin D intake, similar to the adults. It is the parents' responsibility to incorporate balanced meals for their children. Did you know there are 206 bones inside your body? We are born with approximately 270 bones, which fuse to become 206 in human adults. It is characterized by long bones, short bones, irregular bones, and flat bones. Bones, muscles, joints, tendons, and ligaments are all part of the musculoskeletal system. As the name spells out, your bone is part of a skeleton that provides a frame and/or structure to the body. The responsibilities of these features are highly connected. Therefore, an injury or damage to one component negatively influences the others. For example, if an infection occurs in a joint, it will degenerate articular surfaces on the bones within the joint, additionally causing local muscle atrophy. Musculoskeletal injuries and diseases generally result in disability and death. Apart from that, those disabilities can significantly impact your productivity and quality of life. The cells inside your bones are sensitive to the external and internal environment. Therefore, moderate stress enhances bone health, while a lack of stress, such as bed rest, leads to weak bones. There are three main functions of your musculoskeletal system. Number 1, protection and support. The system enhances protection and support to the other parts of the organ, such as the brain, lungs, and heart. Furthermore, it supports all body structures by providing a strong framework. Function number 2. Movement. The musculoskeletal system is also important in mobility. It helps your hands, legs, hip, along with other parts of the body move without any hindrance. This can happen thanks to your joints, which hold the bones together to facilitate the move. Function number 3. Storage for immature blood cells and minerals. Immature blood cells and minerals such as phosphorus, calcium, fluoride, and magnesium are stored in parts of the system. For example, calcium is stored in the bones. Meanwhile, red blood cells, platelets, and white blood cells are produced by the red bone marrow. So how you can protect your bone health or your body's architecture from the inside? Nutrition. Balanced nutrition always has the power to keep you healthy. It significantly influences your body functions, including bone health. Have you ever heard about Hippocrates, the father of modern medicine? He has always been associated with these words, "Let food be thy medicine, and medicine be thy food." These words are true, and I have always mentioned them to my patients or clients. Food has the power to heal as well as to prevent diseases. Nevertheless, it has to be balanced and varied. Your bone isn't the only thing that acts as a whole, but nutrients too. For example, calcium will not fully support your bone health without phosphorus and vitamin D. In the same way, vitamin D needs healthy fats to work its benefits, as it is a fat-soluble vitamin. To have strong bones, you need to incorporate these nutrients in your body. So what are the nutrients that you need to add in your daily diet? Number 1. Calcium and vitamin D. Ossification is a process where the bone is formed. The bone consists of collagen fibers and mineral crystals, such as calcium and phosphorus. Several hormones play a key role in facilitating the absorption of calcium for bone formation. The parathyroid hormone regulates the concentration of calcium in the blood. That is to say, both vitamin D and parathyroid hormone help calcium unlock its full potential in bone health. Remember, vitamin D needs to be made with the help of sunlight. Therefore, it is recommended to take vitamin D supplements if you're not having enough exposure to sunlight. Number 2. Carbohydrates. Your body thrives in food that gives you energy. Carbohydrates provide calories and energy to maintain bodily functions. Similarly, your bone needs this energy to move. So make sure you have enough intake of this macronutrient and support yourself with complex carbohydrates like whole grains. Number 3. Protein. As your bone is made up of cells and tissues, protein is vital to repair them. In addition to that, protein also plays a role in hormone production. So now that you know how you can nourish your bone health from the inside, how can you nourish your bone health from the outside? Strengthening exercise. Generally, physical exercise is important to keep your body from failing health. Numerous studies have shown evidence that exercise is beneficial to the body. Not only that it is essential for physical health, but also mental health. However, many only perform aerobic exercises but fail to incorporate strengthening exercises. Strengthening exercises has the power to build muscle mass, muscle strength, and endurance. This form of exercise also has shown benefits to lower the risk of cardiovascular disease, diabetes, and cancer. The recommendations are to practice either 1 or 2 types of strengthening exercises for at least 30 to 60 minutes. So there are some examples of strengthening exercise, such as lifting weights, squats, push-ups, and sit-ups. Number 2. Healthy weight. Maintaining a healthy weight is important in sustaining bone health. As I mentioned earlier, your body acts as a whole one unit. Therefore, since you need to include a balanced nutrition, You must also include a balanced lifestyle. Number 3. Medical condition. According to a study, both diabetes and dyslipidemia, which are imbalances of cholesterol, link to a higher association of fractures. So patients with these two diseases need to be careful not to fall, as this increases fractures. Control your sugar and cholesterol levels with proper nutrition, exercise, and medications. So, although bone diseases are not famous like heart diseases and cancer, it still affects the population around the world. Most importantly, you would not have structure and the freedom to move around without healthy bones. Healthy bones can be nurtured from the inside and outside with simple guidelines and holistic interventions. However, if you have a higher risk to develop bone disease or are concerned with your bone health, always seek a healthcare professional to assist you.